Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome back. We're in our series right now talking all about our tongue tie symposium, and we're excited to have some more of our guest speakers here today. We've got Shana here and Annette, both talking about the untethered method of integrated team approach to assessment and oral habilitation. So welcome to both of you. It's so good to have you here today.
Oh, we're happy to be here and thank you for the opportunity.
Thank you for having us.
And of course, both of you have spoken at Gold before. I know if you recognize Shana, she was actually here this year doing a session which was absolutely wonderful, facilitating some wonderful students and talking about your journey. And since then, I think you have an update for us, right, Shana?
Yes, I am now in IBCLC as of June 16th this year.
Right? Yeah. Now, that's not the only credential you actually hold, though. Tell us a little bit about your background.
So I am a pediatric occupational therapist specializing in the neonate all the way up until 21. I specifically niche down to my specialty of birth to 3 population, specifically with feeding difficulties. So once I began to experience feeding difficulties in myself with my child, I then explored and gathered continuing education and then became a CLC and then on to take my IBCLC exam and observe and shadow with Annette.
That is fantastic.
It is.
And it's a great story. And Annette, Leary, welcome back to Gold. It's so good to have you here today. Refresh us on some updates because life has really changed for you really in the last few years. Your journey has, moved on, shall we say, to better things.
Absolutely, it surely has. And many of you know I've worked for a tertiary care hospital for many, many years, over 20 years, and I've always had a small private practice and finally took that leap of faith and just went on my own for for complete private practice. But in that process, found a team and a collaborative process because what we found is that the patients were coming to me and going to Shana and then going to someone else, and it was just too much moving around for these tired, exhausted families, so that we put a collaborative together, our company, Baby Bliss.
Yeah, that's right. And that's really how this presentation came to fruition, because we had wanted for a long time to really talk about a collaboration of sorts and what a team would look like. I think for many of us, kudos for you, the two of you working together and finding each other. I know that you have others that work with you as well. But for many of us who are isolated, I think there's a lot of isolation, in the community, right?
Mm-hmm.
And so there's a real craving of you can't do this job by yourself. So you need to have others in the community that have different modalities that you can work with and refer to. So tell me what it was like before. Tell me what it was like before. Yeah.
So for me, it was really big for me to always know my environment and meet with different specialties and say, how can we best serve these families in the community? And Shana herself was working at the hospital. And I said, listen, a lot of these families need help. They can't wait the long wait at the hospital. They don't want to, they want someone to come to their home. Can you please consider doing a business? And what happened? How I bugged her and I bugged her.
She bugged me for years. And I finally would take here and there on the weekends when I did not have so much of a caseload at the hospital. And then it just turned into 2 to 3 on a weekend turned into 5 on one day that I had off, and it grew from there. And we just decided to both of us took a leap of faith of collaborating together, sometimes treating in her home office together. Patients that would come travel to us from the Keys, they would come to see us in her home office, and it just grew and grew. We had to get a physical space.
Yeah, because we find families are even flying in from other states.
Mm-hmm.
We have someone coming from a different country. So we're treating pretty worldly internationally.
Yeah.
That's amazing.
And when Gold came and said, could you do a talk, the talk that they were interested in, I said, yes, my assessment tool is Shana. What assessment tool do you use for deciding if babies have tongue ties and this sort of thing? I said I use a live tool, functional assessment.
Yeah. Mm-hmm. So tell me a little bit. So we're talking a little bit about the advantages, but tell me about, really working side by side with a completely different modality, someone that's got a different lens to you. What have been some of the advantages? Let's talk about you professionally first, and then we'll talk about a bit more about the family. So professionally, what has shifted for you in this last year since you've been working together? And tell me, how many others do you have working similarly in an office with you right now?
We have another IBCLC RN that works in our office with us, Sabrina, and that's her role. So typically she will see them prenatally, do 1 or 2 visits if that's the way it rolls. And then she says, hey, you really need to see Annette and Shana. Shana's going to do the oral motor assessment, functional part, and Annette can do the body work. When you said what else has changed, I have done more and more craniosacral therapy in my practice with lactation, and just kind of, I say I provide lactation services with a side of CST, craniosacral
Right.
therapy. That's what they get. So yeah.
I think our scope has gotten wider, to be perfectly
Right.
honest, not being
Yeah.
confined to the tertiary hospital or
Right.
the insurance demands that some will restrict us on how many visits. I think that has given us a wider lens and an ability to treat the whole dyad and not just parent or baby. We treat both because we are
Right.
both IBCLCs now. But even to before that, we would treat the entire family, mom, dad, brother, sister, whoever was in that room. We were all giving them a care plan. We were all facilitating whole person care, whole family.
Wow, that's amazing.
And that's what
So
we're
whole
finding
family.
more, more and more of the families. I mean, it's nothing for a sibling, and you'll see a picture in our presentation of a sibling trying to do the oral motor. Or I have families come and send me pictures later on of the whole family in tummy time, working on doing body mechanics and movements and, helping. Today, a mom came in and she said, oh yeah, when we role play, my 4-year-old says, I'm sorry, I have to take a break and go pump right now.
That's amazing. I think
Yeah.
that this is really interesting, because I hope that during our session together, and I know, having a little bit of an insight on what's coming, I'm seeing some of that, but I'm really hoping that we can expand out the topic and really hear from folks that really want what you've got, because I think there is something in all of us that wishes, we had that ultimate clinic where we're working collaborative as a team,
And you really have to.
with the whole family, right?
You really
Absolutely.
have to. And I've always done that for all of my years here. When I landed here from Boston to here, that was my first mission, was to get to meet all different clinicians. What do you do in your office? What do you offer for families in your office? And built my network to say, okay, I know my lane I need to drive in. I know my lane I need to stay in, but I've got someone that can take you to that next level that you and your baby and your family needs.
Oh,
So
that's
that's the
fabulous.
most
Yeah.
important thing, is reaching out, asking to collaborate, asking to learn. We get a lot of people who ask us to shadow and, just kind of get an idea of what we're doing. We hold provider nights just so that providers can intermingle, whether it's a photographer or a chiropractor or a doula or a midwife.
Ooh, I'm liking these answers, I tell you.
Yeah.
So I'm going to challenge those folks listening in right now to actually write down some questions that you might have for this team in front of you. I think it's such a great opportunity, because you did build it. You said, let's build it, and they will come, and they have. And I know that you're very busy, and you don't get much downtime at all, which is fabulous, but it also lends to the fact that you have built this very cohesive team. So write down your questions. You can post them in the chat. Come to the live session. We've got forums that are exclusive to all of our participants as well. And it's really easy to register for this event. We should mention right away that this event begins on September 11th, which it will be live. So we have 2 days of live events, recorded, of course, for your own convenience. And you can head over to goldlearning.com right now to check out not only Shana and Annette's presentation, but all the other amazing presentations coming up. I'm truly inspired, to hear what you have to say. And I think that, the questions that come to mind now, and I don't want you necessarily to answer them, but I'm just thinking like, okay, so how did you all meet? How did you know that you were the right fit?
Tell her.
Well, this is my lactation consultant.
That's what happens. Isn't that interesting? A lot of people do end up in that situation. They get inspired, and because they're seeking out something that they're really dedicated to, and ultimately they find someone that's dedicated already to the cause. So that is pretty cool. We see that a lot when we come to these events as well.
And for me, I'm always always been big on building the future and bringing out the younger lactation consultants and people that are interested in more lactation care. Come, follow, learn. I'll
Mhm.
guide you in the direction you need to go. I'll be able to teach you, because eventually I would like to retire at some point in my life. So I want to know that our community is left in great, competent hands, and
Yeah.
knowing that that's a way, by modeling and mentoring, that I can facilitate that. The same with Sabrina, our other business partner. I was her lactation consultant for both of
So,
her
oh my
babies.
goodness. There you go. Well, you heard it. You heard it here, heard it here first, for sure.
Yeah.
Well, thank you so much to both of you for being here today. It really is a joy to have you both on the screen together at the same time. And we'll look forward to hearing your presentation. You know, really, what does that, you know, taking a deep dive, and what does that really look like? The untethered method, integrated team approach to assessment and oral habilitation. I know that there is a lot of wisdom here right now in this room, and so it really excites me that we're going to have the two of you together presenting on this topic. Now, for all of you listening in again, you've heard me say it before, but don't forget to head over right now to the website. You don't want to miss out on this opportunity, because of course, Shana and Annette will be here live. You'll have opportunity to ask questions, and also available in our forums. So those forums are there, they're offline. You can post a question anytime. And of course, Shana and Annette, they're here just to give you as much wisdom as they can to pass it on to those of you that are seeking out perhaps to do some collaborative work and or in the future as well. So thank you once again for both of you joining us here today, and we'll see you all very soon. Bye-bye for now.